to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I miss the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you, because you can't protect yourself. Because I will do anything at all costs to protect my daughter.
Getting the COVID-19 vaccine for me will be a huge priority. I want to do everything that I can to keep my staff healthy. It's really just the only option to resume normal life.
Walking through to the chair where the vaccine was felt like a hero walk. And I feel that everyone who is going to receive the vaccine is going to get that feeling. You know, that split-second jab represented so much hope.
I have my sticker that says I did get my vaccination. I deal with COVID face-to-face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
We all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
It's been really difficult lately. It's hard to teach with a mask on and not being able to project your voice. It's hard to not see the kids' expressions on their faces.
I want this needle to help me to live for a while more so I can enjoy my grandchildren and go big berries and go have fun.
I miss coming to the game. When it's time for me to get the shot, I'm gonna go sit down in the chair and close my eyes and tell them to stick me.
It's going to save not only my life, it's going to save lives of the people around me, the babies that I care for, my grandchildren, my parents. It will be so nice to not live with that fear.
I think I want to
Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe, and joining us virtually is Saskatchewan's Chief Medical Health Officer, Dr. Shahab, and the CEO of the Saskatchewan Health Authority, Scott Livingstone. Premier Moe will have opening remarks, followed by time for questions.
Well, thank you very much for joining us, and good afternoon, everyone. Saskatchewan's vaccine rollout continues to lead the country, and high vaccination rates are what will help lead us through the 3 steps of our reopening roadmap. On Sunday, we reached our first reopening threshold. 70% of everyone over the age of 40 has received their first shot. We are making good progress on step 2 of our threshold, and as of today, 61% of Saskatchewan residents aged 30 and older have also received their first shot. Tomorrow, we will lower the eligibility age to 26 province-wide, and then down to 23 on Friday, 20 on Sunday, and so on. I'm also very pleased to announce that the Saskatoon drive-through clinic will reopen tomorrow, and the Regina drive-through clinic will reopen on Thursday. For now, both are expected to run through right until Sunday. As you know, these drive-throughs have been extremely popular and have allowed us to be very effective in getting thousands of people vaccinated each and every day that they're open. And our goal is to keep the drive-throughs operating as much as possible, and of course that will depend on the supply of vaccines that we receive. Now that people in their 20s are becoming eligible for the vaccine, I want to really encourage young people to make sure that they are taking their opportunity to get vaccinated. Some young people may be thinking that they don't need to be vaccinated, but you do, for a number of reasons. First, you need to protect yourself. COVID is dangerous to people of all ages, including our youth, and the variants of concern that are now present in higher concentrations in Saskatchewan have been shown to be more dangerous to young people as well. Secondly, you need to protect not only yourself, but those around you. You don't want to spread COVID to your friends, to your parents, or ultimately to your grandparents, and all of the other people in your community that you may come in contact with each and every day. And third, we need everyone to get vaccinated so that we can get back to normal, so that we can get back to doing all of the things that we have missed out on doing over the course of the past 14 months. So please, when it's your turn, regardless of your age, go get vaccinated. I also want to remind everyone that is working in Saskatchewan that you can take up to 3 hours off work with pay so that you may go get vaccinated. Every Saskatchewan employer, I would expect, would be actively encouraging their employees to do so. There are a number of young people that may have just began or started their summer job, and they might be somewhat hesitant or reluctant to ask their boss or their employer for time off for those 3 hours to get vaccinated. So I would hope and I would ask that all employers are encouraging each and every one of their employees to get vaccinated and to do so as soon as possible, even if that is necessary for it to be during work hours. It's the best way for you to protect your workplace. It's the best way for you to protect your employees. It's the best way for you to protect your customers. And it's the best way for us all collectively to protect Saskatchewan. Our government is encouraging all of our employees in all the ministries and the Crown utilities to take their 3 hours and go get vaccinated at their very first opportunity. And I hope every Saskatchewan workplace is looking at doing the same. Very shortly, we will begin delivering second doses, and everyone needs to make sure that you get your second dose to ensure that ultimately you are fully protected from this virus. Pretty soon, we are going to have a lot of people in Saskatchewan that are fully vaccinated. So I would like to see the federal government provide some guidance and possibly some direction and maybe even a roadmap on what being fully vaccinated means in terms of things like travel. For example, will fully vaccinated Saskatchewan residents and ultimately many Canadians still be required to quarantine for 2 weeks when they return to Canada from another country? Understanding these are fully vaccinated Canadians. Is the federal government going to develop some sort of an electronic verification that you have that indicates that you have been fully vaccinated for those people that may be necessarily traveling abroad? And now I understand we're not at that point today. We're still a few weeks away from that point, but I would like to see the federal government start to provide some of that very clear guidance on these matters as soon as possible to further incentivize people to ensure that they are not stopping at one shot of the COVID vaccine, but ensure that they are actually going back and getting their second shot. For now, thank you, Saskatchewan, for following all of the public health measures that are in place. Thank you, Saskatchewan, for going out and getting your vaccine when it's your turn, and let's keep this going. Keep following all of those public health orders as we have been. And continue, when it is your turn, continue to encourage those around you to get your first shot, ultimately get your second shot. Let's roll up our sleeves not once, but let's roll them up twice, and let's stick it to COVID. Dr. Shahab?
Thank you, Premier. So I would first of all start with my sympathies to the families and friends of the 5 Saskatchewan residents who lost their lives due to COVID-19 since last Thursday. 4 of these deaths are reported today. And this is again a reminder that we absolutely must stay the course with public health measures. for now, but absolutely continue with taking our first dose as we become eligible, and then planning for our second dose once we become eligible for second doses. And as the Premier said, a vaccine uptake will allow us to continue to have a safe reopening, as was announced, step 1 and then step 2 and 3. And as the Premier said, ensure that our workplaces and our, all the other activities that we enjoy are as safe as possible over the summer and then leading into the fall. And I think it's really critical that we achieve high vaccination rates in all age groups. We need to be inspired by our elders, 80 plus, 88% uptake, 86% uptake, 70 to 79. And they should inspire us to roll up our sleeve when we become eligible. What we see is that we see an initial quick uptake in younger age groups, and then it seems to level off. But we need to make sure that all of us plan to get vaccinated. And as the previous said, you can go and get vaccinated while you're at work. You can get vaccinated at other times. There's abundant access to vaccination clinics through pharmacies, public health clinics throughout Saskatchewan. And it's essential we quickly take up our first dose as we become eligible, and very soon all of us will be eligible. And then as second doses schedules are announced, we quickly complete the series with our second dose. More than half of Saskatchewan's eligible population has received one dose. The vaccine is safe and effective. We have seen less than 0.1% of breakthrough cases. I know other provinces are reporting that. We have looked at our own data, and it is remarkable how little COVID illness we see, even with one dose in arms. And I think that is remarkable. No one expected the vaccines to perform so well, and they are. So if anyone has any questions outstanding about vaccine safety or efficacy, do talk to your pharmacist, your physician, your healthcare provider, your public health nurse. Vaccines are safe, effective, and we really, they are coming in an abundance now, and we must make sure that we take the vaccines as soon as they come, and which will help us to reach closer to our goals of community immunity and a safe reopening. We have been receiving some questions about AstraZeneca. As we know, in December, our vaccination programs are primarily Pfizer and then Moderna, and then AstraZeneca we only started middle of March. AstraZeneca, actually, the second dose is recommended 12 weeks or later, and we have up to 16 weeks to get the second dose. So most of us will become eligible in the first to second week of June. But there is good information emerging, and we'll be confirming the same over the next 2 weeks, that any vaccine such as Pfizer, especially as a second dose, is perfectly safe and effective if your first dose is AstraZeneca. And if we have AstraZeneca available at that time, that can be offered as well. So either AstraZeneca or Pfizer as a second dose would be safe and effective once those who received AstraZeneca become eligible. So overall, I think we have a clear roadmap to high uptake of first doses and then high uptake of second doses very quickly over the spring and summer. And I think I'll just reinforce that is going to be essential for us to have a good summer and a good fall. Thank you very much.
Thank you, Premier Moe and Dr. Shahab. We'll take questions now, and we'll start in the room. Lynn?
Prime Minister Trudeau recently asked provinces to hold off on loosening restrictions until they hit like 75% of the adult population vaccinated, and cases were trending down dramatically. What do you say to that, Premier, and are other provinces already asking Saskatchewan about its own reopening plan?
Yes, the provinces are talking to Saskatchewan, as we have throughout this pandemic, with respect to the reopening plan that we had put forward. I saw the Prime Minister's comments just a short while ago, where he said it's going to be something like a one-dose summer, and the fact of the matter is we're not going to have a Trudeau summer here in Saskatchewan. We're going to have a one-dose spring, quite likely a two-dose summer, as we are planning to have second doses available to everyone in the province by sometime in the middle of July. So quite different from what the Prime Minister had indicated. We're also feeling fairly strong about the vaccination uptake that we're seeing occur here in Saskatchewan, and we'd put forward our reopening roadmap based on exactly that, the uptake of vaccines here in the province. In addition to that, we have the 3-week interval after the point of where we reach the achievement level. For example, we reached the 70% of 40 and over last Sunday. May 30th is our date then, 3 weeks later, that we would move forward with the phase 1, which is not a broad reopening phase. In that time between last Sunday and May the 30th, we will make that first dose of vaccine available to everyone in the province. Everyone in the province will actually have the opportunity to be vaccinated before we even move forward with that very early phase 1 reopening. Today, we're sitting at 72% of those over 40 that are being vaccinated. Will likely be over 75% of those over 40 when we start with our opening of phase 1. We're at 51% today of everyone, all adults, all eligible adults 18 and over that are vaccinated. That is going to climb in the next number of days between now and May the 30th as well. Ultimately, by the time we move forward with a phase 2 reopening, which would be 3 weeks after two criteria have met. One is we've been through the first 3 weeks of May 30th, out to May 30th, where phase 1 has started, and the second criteria would be ultimately that we hit that 70% benchmark of 30 people 30 years and over. We would then move forward with phase 2. It's quite likely we will have a very high vaccination rate. We'll be into our second doses by that period of time. Will likely be somewhere near where the Prime Minister has even mentioned here today. I think it's important for us to recognize, and important for the Prime Minister to recognize, that we're not going to just turn a switch and the economy comes on when we hit 75% or some magic number. You need to gradually reopen the economy, bring people back into their communities, allow people time to reintegrate back into what life used to be like. And the examples that we have used to model our plan after are examples that have actually worked in other areas of the nation. And I again point most specifically to the UK. But by the time we do have a significant reopening here, phase 2 and ultimately phase 3, we'll be at very high first dose numbers and likely by phase 3, quite high second dose numbers as well.
Follow up, Lynn?
Yeah, so Alberta's already announced stopping their AstraZeneca shots basically permanently, as far as we can tell. And Quebec and Ontario are looking at vaccine mixing for their second doses with AstraZeneca. And Dr. Shahab mentioned this a little bit already, but what is Saskatchewan looking at for their AstraZeneca? Are we still planning on using it for second doses, or only if we have to?
We have Scott, you might have a comment on this, on our supply, and Dr. Shahab as well. We have a very, very few number of AstraZeneca shots that remain. Looking at all options with respect to second shots, if there is AstraZeneca available, which we do not have any indication there will be at this point in time, which would cause us the reason why we're looking very seriously at looking at a Pfizer vaccine for the second shot of those people that received an AstraZeneca for their first shot. I believe there's Dr. Shahab will have more to say on that, and I think we'll have a lot more clarity to add on that, likely as early as next week, as to what precisely Saskatchewan's plan as we move forward. So, Scott, maybe first on AstraZeneca supplies, what's there. What the plans are for any additional first shots, ultimately second shots, and then Dr. Shahab on the second shot AstraZeneca Pfizer conversation.
Thanks, Premier. So we, as we've talked about a lot, our immunization strategy right now is really focused on Moderna and Pfizer with respect to AstraZeneca, because we were lucky to get early allocations of AstraZeneca and put them into drive-through in Regina on March 18th. We had some high uptake, and we're very thankful for that. AstraZeneca is a vaccine that is highly effective and safe, and it has saved lives in our province, and it has prevented infection in over 65,000 plus individuals, including 5 members of my family. With respect to second doses and what goes forward, is we're just not sure about allocations in the future. We do know that we can give AstraZeneca for a second dose, and it's still highly effective, but also, as you've heard from other jurisdictions using an mRNA vaccine to boost the AstraZeneca is also acceptable. I don't believe we made that decision yet because we're not sure if there will be future allocations. We are not currently using AstraZeneca as a first dose strategy right now. We just simply don't have enough of the vaccine in the province. Dr. Shahab, did you want to add something?
Yes, I would just say that either AstraZeneca or Pfizer as a second dose is perfectly fine and highly effective. So depending on supply, when individuals received AstraZeneca first dose become eligible for second dose, likely starting in the first week of June, either vaccine is fine, and likely based on supply, Pfizer would be the likely second dose given.
We'll take another question in the room. Murray?
Is there a specific strategy, or will there be a specific strategy to encourage younger people, now that you're moving into the 20 age bracket, to come forward and vaccinate? There was considerable controversy early on about frontline workers not being vaccinated first, obviously, and now you're dealing with the age group where there's a lot of them who are working on front lines. Is there some plan on the part of the government to specifically address those young people and encourage them to get out and get vaccinated?
Yeah, there is, and I think much of it is already in action. We've seen some additional ads come out with a number of Rough Riders and others that would resonate with the maybe 20 to 40 age group or 18 to 40 age group, and also I think in fairness, however, would be useful for people of all ages that are working, but we had moved very early on the 3 hours of paid leave for people to ensure that they go not only and get vaccinated, but go and take the first opportunity that they have to get vaccinated, is so that we're all vaccinated with that one dose as quickly as possible. However, that would be available to everyone that is working. I think it's fair to say that we most certainly did have conversations around ensuring that was available for many of our younger adults that are working in those frontline industries, so that there was one less barrier, meaning 3 hours pay, the time to go get vaccinated, and ultimately the 3 hours of dollars they would receive. That was very much focused on our younger, often frontline workers, to ensure that there was one less barrier for them to go and take the first vaccine that's offered to them. And they are showing up. I think, in fairness, we're seeing our 30 to 40-year-olds are showing up in strong numbers. Dr. Shahab, you might have actually a comment on the numbers of people, or Scott, on the numbers of people that are showing up. And we're very positive on even our 20, as we're into our 20s now, our 20 to 30-year-olds. They also are showing up. And I just say to Dr. Shahab has mentioned this many times, and I would ask our younger age people in our population to really take inspiration from your parents and your grandparents, who have showed up in very, very high percentages, far greater than 80% in some of our more elderly categories. You can go out, get the vaccine. It's very quick, won't have a large impact on you, or at least it didn't on me, and ultimately keep yourself safe and keep your family members safe as well, and get back to normal, which is what we're looking for. Dr. Shahab?
Yeah, I would just like to add that, in Saskatchewan, we have a very strong vaccination program for children, young adults, and our uptake in school-age children, even in high school, or as young adults, when we become eligible for our booster doses for other vaccines, are very high, high 80s, high 90s. So there's no reason, in my view, why, we will not all step forward in each age group. And we have to remember that, this is a long-term strategy for us, that the vaccine provides individual protection at a high degree, and as the Premier said, while we are very fortunate to see a dramatic reduction in hospitalizations and deaths in people who are older due to vaccination, we can't underestimate or take COVID for granted, because rarely, even in young people, it can be a severe illness. And then, of course, as we look forward to the summer and fall, to increasing gathering sizes, to travel within Canada and internationally, vaccines are our passport to a normal life in Saskatchewan, and nationally and internationally. So I think, and I've always said this, we only have to look at the international news how fortunate we are in Canada to have vaccines available for all of us now in the month of May, and we really should take advantage of this. Thank you.
Scott, you might, I don't know if you're ready to speak on it this week as well, but one other younger segment of the population that has become available recently is a 12 to 15-year-old with the Pfizer mRNA vaccine. I don't know if you have roughed out, most of those kids, understanding, are in school until the end of June. I don't know if you wanted to say a few words on that this week or potentially next week.
Sure, I can add a little today and certainly flesh it out more next week. We are meeting with the Ministry of Education and school divisions right now this week, identifying all kids, school-age kids across the province, and providing that information to our immunization teams regionally so that they can plan the in-school vaccination program, which we're very familiar with, as Dr. Shahab has talked about a lot. It's really been the mainstay besides the flu vaccination in long-term care. Child immunization is one of the oldest immunization strategies we have. It's well organized and very, very high uptake. So we're getting those things in place now. The program will be launched very early in June. But as you also know, we're opening it up hopefully to 12 plus even before that in the month of May. So we will be seeing some kids trickle in both to our other immunization programs, either drive-throughs or book clinics or even pharmacies, which is fully acceptable, and we'll take some of the case numbers away when we go into the schools. But we are actively planning and we'll be well prepared to do that when the time comes in early June.
Follow up, Murray?
The vaccine hesitancy wall with the older generations, I realize this gets asked to you almost every week now, but the numbers are slowing down in the older age groups. It could be because that many have been vaccinated, but we're not getting to the hopeful 100% yet. And I'm just wondering if you're concerned right now whether this is going to be as good as it gets in some of those older age groups because of hesitancy.
When you look at, and Dr. Shahab and Scott, you both might have a comment on this as well. I would say no. When you look at the 10-year segments, and this is in the news releases that we release, I believe, each day, but 80 plus, which we're up over 88% vaccination rate in our 80 plus. 70 to 79 is closely behind 87%. 60 to 69 years of age is 80% as well. And these are the numbers that Dr. Shahab is asking our more youthful members in our society to take inspiration from and to try to achieve, which means if you're asking yourself about whether or not you should get a vaccine, you should. When you get down into the 50 to 59 age group, we're about 67%, but still climbing. And I'm just thinking, I'm going off memory here with respect to, this is the May 10th, May 11th numbers. I believe I was looking at the May 6th numbers this morning, and that 50 to 59 age group is up 3, maybe 4% in 4 or 5 days. So it's still continuing to climb. The 40 to 49 age group was about 55%. I believe that was up 9 or 11% in the last 4 or 5 days. The same with the 30 to 39 group, which we're heavily into today, up to 9 to 11% in less than a week. And so they're continuing to climb. And so we're I think happy with the uptake of the vaccines thus far. I'm happy with the high numbers that we see in our elderly years population, and really challenging our more youthful years in the population to try to meet those numbers that our parents and our grandparents have hit. Dr. Shahab, do you have some additional comments on that in a general way?
Thanks, Premier. Yeah, I would just reinforce the same that, our vaccine uptake is coming up for each 10-year age groups, because once eligible, you remain always eligible. But again, for people who, for whatever reason, haven't come forward in their 60s and their 50s, while you're eligible, going forward, there's no reason to delay. I think, COVID is going to be around. It can have unpredictable and serious consequences. And, getting vaccinated protects you to a very high extent. And the more of us that are vaccinated, the more of a community immunity we have that protects the very few people who, for some reason, may have been vaccinated and may not mount a full immune response. So I think it is critical that all of us, in whatever our age groups are, we think of finding a convenient time to get vaccinated over May and June for first doses. And then, of course, remember to get your second doses starting in May, but over June and July. Thank you.
There's one other segment there that would actually tie into that, and I don't imagine it would be that large this past year, but there still are a number of people that were out of country this winter and were vaccinated in another country. And so we've asked those people as well to get in touch with eHealth at the first opportunity and provide them with your vaccination information. So one, it's part of your healthcare profile, but two, it'll also then be included with the percentages that we have here. I don't expect that to be a large number, but there are people, and I talked to one this morning, for example.
We'll take our next question on the line. Operator?
We have Lisa Schick with CJME.
Hi. Dr. Shahab, did you say that we have numbers of how many people who have gotten their first shot who have since tested positive for COVID? And if so, what is that number?
Thank you. So I'll just read on some data that we actually just analyzed early this morning, and then we can follow up with some written information as well. So this is just analyzed this morning, and I'll just actually open up the details. So, I think similar to other countries and other provinces, we have analyzed breakthrough cases. So that means cases 14 days or 3 weeks after vaccination. And as the Premier said, for a reopening plan, we have given a 3-week buffer because your immunity starts developing 2 weeks after vaccination, and after 3 weeks is better. So when we look at 21 days after vaccination, we have 263 individuals who developed a COVID infection more than 21 days after the first dose. And this was out of this analysis was done up to May 8th. This is based on 309,276 first doses given up to and including April 17th, because obviously we are counting 3 weeks before. So the doses up to April 17th, and then how many cases till May 8th, 3 weeks and later. And so the breakthrough cases are 0.09%. So the vaccine effectiveness is, 99% and higher. So I think this is quite remarkable, actually, that with just one dose, the vaccine is protecting us so well. And that reinforces the fact that all of us need to get vaccinated and, of course, follow up with the second dose as well. Thank you.
Do you have a follow-up, Lisa?
Yes. Again, for Dr. Shahab, you've said a couple times that using Pfizer for a second dose if the person had gotten AstraZeneca is safe. Does that mean that British study you were looking at is back, or I guess what is that statement based on?
So both us and our colleagues nationally are looking at studies ongoing in the UK that have started doing preliminary assessments as well as other studies. So they are all suggesting that a second dose of Pfizer following a first dose of AstraZeneca gives exactly the same level of protection as a second dose of AstraZeneca. So I think that's very reassuring, and that will likely be what will be offered in Saskatchewan as a second dose. If we do have any additional supplies of AstraZeneca, there'll be a choice that if you got AstraZeneca first dose, you can get second dose AstraZeneca or Pfizer. But if supplies are constrained, that by no means mean that people who got first dose AstraZeneca will have to wait longer for a second dose. Pfizer is equally safe and effective from the data we have. But as the Premier said, over the next 2 weeks, we will get further information to confirm this.
We'll take our next question in the room. Mark?
Regina's active case numbers dropped below 500 for the first time since mid-March, but test positivity remains relatively high. Are we worried that we're missing cases in Regina and that could lead to a surge again in cases here in the city if restrictions are loosened?
I'm always concerned about our cases. Scott and Shahab, if you would like a comment, I'll just have a short comment, but always concerned about cases, not only in Regina, but particularly in Regina, because of the high level of variance of concern that we've been dealing with here for a while, which is why we've had the increased measures that we have in Regina. Thankfully, Regina people have been following those measures. Thankfully, we've been able to provide many more vaccines than where we were in Regina maybe even a month ago when those measures came into place, and that's allowed us to make some decisions around, in particular, restaurants, long-term care facility visits here in Regina as well, and ultimately will allow us the increased access to vaccines today and in the days ahead is ultimately going to allow us to move forward in Regina with our Phase 1 reopening alongside the rest of the province. So, Dr. Shahab or Scott, anything on the test positivity rate in Regina?
Yeah, so as of today, our provincial test positivity is 6.2%, and for Regina, cases per 100,000, 16.8. They are coming down significantly. Test positivity 8.2%, so it is coming down. It's below that 10% threshold. We would like it to go down even further. And we have to also remember total testing rate per 100,000 remains acceptable for Regina at 208 tests per 100,000, and provincially our testing rate is 266 per 100,000. So we have to remember that even as our numbers come down, even as we get vaccinated, we need to continue to get tested to make sure we are not missing cases. If you are unvaccinated, but even if you are vaccinated, if you have symptoms, get tested. That way we can make sure that we are not missing any COVID case or any variants of concern, were new variants of concern to come. But, I think we have to recognize that, people in Regina worked extremely hard and to bring case numbers down. And I can look forward on May 17th to joining the rest of the province with the public health measures that then will be the same throughout the province. And then as our vaccination rates continue to go up, all of us can enter step 1 of the reopening plan. Thank you.
Follow-up, Mark?
Saskatoon's active case count, on the other hand, is on the rise and now surpassed Regina. Do we know what's behind that spike, and would the province consider pausing the reopening for jurisdictions with higher transmission rates?
We would, but not the rate level that Saskatoon's currently at. They've been fairly stable. I would categorize it as fairly stable in and around 500 cases for a number of weeks now. Regina, thankfully, has dropped down to be below where Saskatoon is. So Regina has been on a downward trend. Saskatoon has been, I think, stable for a number of weeks now, and there's, I don't think there's anything in the numbers that are there today ultimately that would in any way threaten moving forward on the reopen plan. In fact, the numbers would not be the only metric that we would most certainly look at. There's a number of other metrics, all of them driven ultimately by our access to vaccines and the uptake of vaccines here in the province. And so we expect those numbers to decrease in the weeks and months ahead. Ultimately, our hospitalizations to decrease in the weeks and months ahead, like our numbers have for the last few weeks here in Saskatchewan. Both our hospitalization as well as our case numbers, I think both are down in excess of 20% over the course of the last 3 to 4 weeks, which is a positive trend, but still more to do.
If I could add to that, I agree that Saskatoon is stable, test positivity 5.8%, cases per 100,000 14.9, and the wastewater surveillance also showing a downward trend. And I'd like to reinforce, as the Premier said, we are not seeing super spreading events right now because we have quite stringent public health measures throughout Saskatchewan, no household bubbles, no large gatherings. And if we are to enter our reopening step 1 and beyond safely, the most important thing is to get vaccinated. And like the Premier said, most of our cases currently throughout the province are in people who cannot work from home, who have to work in a workplace. So we see small clusters, 2 or 3 cases in workplaces, and then secondary household transmission. And the best way to prevent that, obviously follow the COVID protocols at work, but also get vaccinated, because the quicker our working age population is vaccinated, the quicker staff in schools are vaccinated, teachers and staff, and parents of children who go to school are vaccinated, especially parents of children under 11 and under who can't yet get vaccinated. the quicker we will see a further reduction in case numbers. And my final comment is, we are seeing a bit of an increase in case numbers in the northwest and far northwest of the province. We are seeing an increase in variants of concern, especially P1, and that's an area that we need to pay special attention. We need to promote higher vaccine uptake throughout the province. We need to minimize non-essential interprovincial travel. If you do travel outside of the province or come into Saskatchewan, get tested on arrival, and at day 10, follow all local public health measures. And that is also going to be critical going forward. Thank you.
We'll take another question in the room. Adam?
What do we do to convince people? I know you talked about younger people in their 50s and 60s and 40s, is about 150,000 who haven't got a vaccination yet. Is that a matter of convincing people who are on the fence? Is it a matter of demographics or getting the vaccine to hard to reach places or hard to reach communities? What do you think the holdup is there, and how do we overcome that?
Well, first, I would say that I don't think there is much of a holdup. We are seeing, people in their 50s, 60s, 70s, 80s, 40s, 30s, all going out and the majority going out and taking their opportunity to receive a vaccine. And we hope that continues right down through the age groups. And we know there are some people, for whatever reason, some of them will have a valid reason as to why they aren't able to receive a vaccine. But some will just choose not to, and that is their right ultimately. But if we have too many people that choose not to, it is going to challenge the safety and health in our society, and ultimately our ability to reopen our society as quickly as we possibly can. Listen, there's been lots of talk in the last number of days around people that want these measures removed. Some feel that the best way to have them removed is to go out and, for example, join a public protest. That is not the best way to have the public health measures removed. The absolute, bar none, best way to have the public health measures removed is to make your appointment, go receive your first vaccine as soon as you're eligible. Then, very quickly, when you're eligible for your second shot, go receive your second shot. That is our path back to normal. It leads through one of our vaccination clinics here in Saskatchewan. Ultimately, Dr. Shahab had talked about the efficacy of these vaccines, even after one dose, being in excess of 99% preventing not only severe outcomes of COVID, but actually preventing an infection of COVID. The vaccines work. They work extremely well. And we'd ask all Saskatchewan people to go out and get your shots so that we can get our communities back to some semblance of normalcy. And we're seeing that in many age groups or thus far. And we hope that'll continue right down through to every eligible age group in Saskatchewan. Dr. Shahab, do you have anything to add on that?
Yeah, I'll just say that, obviously, sometimes there is vaccine hesitancy, either individually or within families. And I would really urge people who have questions to go to credible websites. We have information on our website, or to talk to their physician, public health nurse, pharmacist, because absolutely, and again, I can't say this enough, that, COVID is still ravaging the world, and it has enacted a sharp price globally in terms of lives lost and economic and social disruption. It has been a significant pandemic. And, to be blessed to be able to get vaccinated and then not get vaccinated, I think from a scientific sense, it doesn't make sense. But even from a societal sense, from being a member of a community, a family member, there's little reason not to get vaccinated. And the risk to yourself and to people close to you will continue to remain if you remain unvaccinated, because COVID is not going away anytime soon globally. The rest of the world may not get vaccinated till end of this year or early next year in any appreciable amount. So really, the best protection we have going forward is to be fully vaccinated, and that allows us to then, start decreasing some of the restrictions we've all have faced, and which, as the Premier said, people have expressed their frustration. But expressing frustration doesn't do anything to COVID. It opens up the entry of COVID, and the way to get out of it is through vaccinations.
Follow up, Adam?
You mentioned wanting the federal government to set out some guidelines, Premier Moe, on what you'd be able to do with a second dose and even a first dose. Is the government going to share health information for vaccine passports because the provinces have that information? What are you looking for, and what would the province do to help that process along?
Well, domestically, I don't know if there's a place for passports. I can't see that there ultimately would be. Yeah, but internationally, I think now when you travel today to certain areas of the world, there are vaccinations that you need to produce or have before you travel to those areas. So I would suspect that there will be areas of the world, if not many areas, that will require you to have 2 doses of your COVID vaccination before you travel to those areas. What we're asking Canada to start to do, and again, not for today or tomorrow, but for the weeks ahead, as we know, in a couple of weeks, we're going to start vaccinating very ambitiously in the month ahead. Our second doses in Saskatchewan, 2-3 weeks after they receive that second dose, they're going to start wondering and making plans for potential international travel later this summer, early maybe through the fall into the winter. And they would look to the federal government for guidance on if they are to travel abroad to certain countries, and we see the UK doing a color-coded system that is ranking countries on how long you may have to isolate or whether or not you will have to isolate on return. Saskatchewan people, and I suspect many Canadians, are going to be asking the same questions of the federal government. If I travel abroad to a certain country, what are the standards or what are the requirements with respect to quarantine, testing, on my return to Canada? And I think the question is should those be the same for someone that is unvaccinated versus someone that is vaccinated? And that is the federal government's court to play in. But we would ask them to provide some guidance, a roadmap, if you will, for. We'll ask for Saskatchewan people, but I think, in fairness, all Canadians are going to be wondering this or asking the same questions in the months ahead. I'd maybe just back up to your first question as well for just a moment, Adam, on around certainty, and we've all searched for certainty throughout this pandemic, and now we're talking about certainty of vaccines, and Dr. Shahab had shared some efficacy data with us that is points to all 4 vaccines, 3 that have been delivered in Canada and Saskatchewan, but I suspect all 4 vaccines, including the J&J, have a fairly high efficacy rate. The 3 we've delivered have a very high efficacy rate. But one of the challenges that we are having with certainty, and is the lack of clarity that we're receiving from our National Advisory Council, or NACI. And they owe it to Canadians to be much more clear than they have been with the vaccines that we have had available to us. We have currently, I believe, about 300,000 J&J vaccines that are sitting in storage in Canada, are rendered useless essentially, or I don't know where we'd use them at this point in time in Saskatchewan, as they are advised to be provided to people 30 years and older, and we've gone by that benchmark here in Saskatchewan by the very ambitious vaccine effort that we have put forward through our SHA, our pharmacies, our communities across the province. And so, very much more rapid and clear guidance from our National Advisory Council would always be appreciated. It's been just one more piece, I think, or one more step that has provided some uncertainty around the vaccines that we are offering Saskatchewan residents, but very thankful for the very clear guidance that has always been provided by Dr. Shahab. And he provided more of that today with respect to just how effective the AstraZeneca, the Moderna, and the Pfizer vaccines are, even after 1 dose. And ultimately, I think for us that, maybe traveling abroad, and we'd encourage everyone, likely going to need 2 doses in order to do that. And we'd encourage everyone to ensure that they do get the 2 doses, give us the maximum degree of protection that we can in this province. Let's not only have a very high vaccination uptake rate, but let's have a very high full vaccination uptake rate in Saskatchewan, and we're going to have a very, very different summer than we did last summer. We're going to have a very open and enjoyable summer. As we get into July, provide as many of those second shots to Saskatchewan people as we can. And hey, we have a football team that's going to start playing football here in August, September, and we want to get into that stadium and cheer them on.
We'll take our next question on the line. Operator?
We have Ryan Kessler with Global.
Yes, good afternoon, and thank you for taking my call. My first question is probably best posed to Mr. Livingstone or Dr. Shahab. What is Saskatchewan's current AstraZeneca stockpile? And can you also confirm what I think I heard, which is that AstraZeneca is no longer being used in first doses?
Scott, I think you spoke to that.
Go ahead.
Go ahead.
We can
Okay.
hear you now.
Yeah, sorry, I was on mute. Ryan, what I was saying is that I don't have the exact number, but I can certainly get it from the EOC team and immunization team. But the number of doses of AstraZeneca province-wide, including those with ISC, Indigenous Services Canada, are very low. We have not been offering first dose clinics with AstraZeneca. It doesn't mean we wouldn't give it if we had enough doses to do so. But we are holding on to those doses now and primarily almost exclusively using Pfizer and Moderna going forward until we at such a time get an assurances of AstraZeneca shipments. There are over 65,000 individuals that have received doses of AstraZeneca province-wide back into, I believe, starting March 18th. So we haven't come close to the window where the second dose is required, and that's why we're waiting and watching and haven't made a final decision on what second doses will look like for those individuals that receive first doses of AstraZeneca, which is what Dr. Shahab has said, I think, more than once today, but I'll leave it to him to follow up on that answer.
Thanks. So, first of all, I have to reinforce that globally, AstraZeneca, Johnson & Johnson are critical vaccines in terms of safe and effective vaccines. At present, our bulk of supply is Pfizer and Moderna. And so for first doses, we are using Pfizer and Moderna. And for second doses for AstraZeneca, Pfizer would be acceptable. If no AstraZeneca is available, it is as good as a second dose with AstraZeneca based on information we have to date. So, based on that, I think, we look forward to completing our series, in our case in Saskatchewan and most of Canada, with Pfizer and Moderna, both remaining first doses and remaining second doses. But again, there are many safe and effective vaccines globally. But in our case, the bulk of first and second doses will be Pfizer and Moderna. Thank you.
Do you have a follow-up, Brian?
Yeah, my follow-up question is also for Dr. Shahab. You've mentioned several times now that Pfizer is a safe option for a second dose for people who received AstraZeneca the first time around. What about Moderna as a second dose?
Yeah, so first of all, interchangeability among Pfizer and Moderna is also well established that while, you try to complete the second dose with the vaccine you got as a first dose, but, certainly in situations where you can't get the second dose of the same product in a timely way, you can easily give, Moderna second dose to someone who got Pfizer first dose, or Pfizer second dose who got Moderna first dose. So that's, established and supported as well, both in Canada and other parts of the world. But specifically for second dose, Pfizer as a second dose to someone who got AstraZeneca first dose, most of the studies we are reviewing, including studies from the UK, have actually done trials of, first dose AstraZeneca, second dose Pfizer, or first dose Pfizer, second dose AstraZeneca. So because the trial data at this point suggests that Pfizer is safe and effective as a second dose, that's what we would recommend. But, I would think that, if there was no other option but to give Moderna as a second dose, there should be no concerns there as well, because they're based on the same platform. Thank you.
We'll take another question on the line. Operator?
We have Julia Peterson with the Canadian Press.
Yes, hello. I saw that there are still some opportunities for Canadian essential workers who have been traveling to the States to get their vaccinations in North Dakota and Drayton. Do we have any sense of how long that opportunity is going to be lasting for, and whether there are any other potential partnerships in the works?
I just very quickly, and I believe there's some information in that in today's news release, which I have somewhere here, with respect to changing the hours of availability for the program that we have put forward in North Dakota, just south of the community of Estevan. I believe at Kenmare, North Dakota, and I believe Manitoba has a similar program running south of the Pembina border as well. They, I don't know how many weeks that will run. Scott, you may know, but they are south of Estevan vaccinating truckers that are crossing the border, have been crossing the border throughout this pandemic, as well as a number of energy workers, essential workers that are required to cross the border. So we're very, very grateful to the state of North Dakota, and in particular Governor Doug Burgum, who we had a number of discussions with on this topic. We were very supportive of them moving forward, North Dakota moving forward with the first step of this plan, which was the site south of Winnipeg, north of Grand Forks. As we know, many many Saskatchewan truckers do head out through Winnipeg down south into the U.S. Midwest and the eastern seaboard, and ultimately use that Pembina border crossing. So Saskatchewan truck drivers have been being vaccinated at both locations, and the location south of Estevan has also included a number of other essential workers, including a number of energy workers that are crossing the border there as well. And I believe they've either expanded or just shifted the hours to be more appropriate for those that are crossing. And I don't have that in front of me, but it was in either today's news release, or here it is here. Starting tomorrow, May the 12th, the vaccination clinic at Drayton, North Dakota is changing its hours. Eligible truck drivers and essential energy workers will be able to receive their vaccine between 10 a.m. and 6 p.m. on Wednesdays, Thursdays, and Fridays. So a slight adjustment in the hours. It's been working well. However, in saying that, we are running down through the age groups in Saskatchewan as well. So many of those folks also not today are eligible for their vaccines when they are back in Saskatchewan. But forever grateful to Governor Doug Burgum and the state of North Dakota for their generosity.
Do you have a follow-up, Julia?
Julia, sorry, Julia, if I could just add, I know many of them, the truckers that and the people that had received their first vaccine, had a date set at that point in time for their second vaccine, 3 weeks, I believe, in advance. So it'll run through the full vaccination cycle, and they are committed to the full vaccination cycle, not just the first dose. Pardon me.
You can go ahead with your follow-up, Julia.
No, that covers it.
We'll take our final question on the line. Operator?
We have Josh Ryan with Battleford Now.
Hi, thank you very much for taking my question. Now that we've moved along with vaccination rates and they continue to increase, in addition to vaccination and other health measures, is there any plan for the province to add additional resources on the government's website for residents to take other measures to help protect themselves and increase their immunity, such as links for nutrition and exercise and that sort of thing?
Dr. Shahab, would you have anything to add to that?
So I think we already have, through our public health measures, that what are the steps you need to take to prevent yourself being exposed to COVID. And those measures, some have been long-standing, like mask use in indoor public places, hand hygiene, maintaining a 2-meter physical distance. Some have ramped up when case numbers went high. So right now, throughout Saskatchewan, you can't meet outside your immediate household except for specific situations. And we have outdoor gathering limits of 10. And of course, reopen Saskatchewan guidelines for restaurants, bars, and other public places. But obviously, all of these will be reviewed as we move forward under reopening, because we are confident that once our vaccine uptake, first dose and then second dose comes up and the numbers come down, ultimately we would want to start rolling back some of those measures to enable us to, behave more normally as much as possible. And like the Premier said, that won't happen immediately, like flicking a light switch. We have a very very graded, systematic process. Step 1 allows for specific relaxation, similar to when we reopened last year when our case numbers were low, but we have the additional protection of vaccines and some additional concern of variants of concern, but we know how to handle them. We were able to drive them down even without vaccines through public health measures, and now vaccines, so far all the vaccines are effective against the variants of concern that are currently circulating in Saskatchewan, so I think that's good news. But obviously we will have to see what public health measures we can safely remove, and that's part of the 3-step reopening program. And then finally over the summer, how large can our gatherings be safely? What's the role of physical distancing, mask use in indoor public places? All those are considerations for July. And then of course, the second dose is essential for long-term protection. And why I keep saying that is that the last thing you want to see is a fourth wave in late summer, early fall when we move indoors again. So that's the second dose is our protection against, is our long-term investment, where we are not just looking at a great summer, but also a great fall. And that's why completing the second dose is important as well. But I would like to say that, as we go through this, the Premier also mentioned, some of us are raring to go once it's possible to invite people at our houses. Some may be more cautious, and all of that is fine. I think individually we will have to find our own comfort level with, doing things which we weren't doing before. And really, I would say, while vaccines are not required, we should have. I'll be having conversation with my friends and family that, are you vaccinated? Before we get together, I want to see everyone I meet and greet more normally in the future to be fully vaccinated. Thank you.
Josh, I just add to that, our personal health, not only physical health, but our mental health is something that I think we all, need to continually focus on. And I know for myself over the course of the last year where, public events and things have slowed down to some degree, it's provided me an opportunity to look at both of those. And I think in many cases, it's provided many of us that afforded many of us that same opportunity. So our personal health, both mental and physical, is of the utmost importance, not only for defending ourselves against a COVID virus, but for defending ourselves against the many other diseases, including those affecting our mental health that we're susceptible to ultimately as humans. What this does provide us, I think, for is an opportunity as we move forward to look at the general resiliency of the healthcare system that we have in Saskatchewan and how it provides services to the people of the province. And those are some pretty simple questions that I'm sure we'll be looking at when we ultimately find our way through this COVID pandemic. For example, are the PPE supplies, the flow of PPE through our system adequate and appropriate? Should we run into a challenge like this again? And is our testing, contact tracing capacity, is it appropriate for the weeks and months ahead, not only for COVID, but for other diseases that we test and ultimately need to contact trace for from time to time? And thank goodness we have the Roy Romano lab and have been able to augment that with some private lab capacity here in Saskatchewan. And how do we balance that in the years ahead? Our vaccination capability through the SHA and also now augmenting that with our pharmaceutical capacity. I think in fairness, Scott might speak to this more, but I don't know that we realized we had the ability to deliver as many vaccines as quickly in as many communities and as thoroughly across the province as what we're doing today in this province. And it's a joint effort from so many healthcare providers, private and public, in community after community. And, let's make sure that we're recognizing, what our capabilities are as we move forward should we be faced with something similar to this in the future. And let's also make sure that we're recognizing where we may have had some challenges and plugging those holes should we be facing something like this. We're going to have a conversation very shortly, likely starting already in many areas of Canada, including Saskatchewan, but surgical wait times have increased, not just in Saskatchewan, but in in every province across Canada over the course of the past year. The federal government has recognized this by providing some healthcare funding directed at the surgical wait times in Canada to the provinces, and it's going to have to be a very strong effort by our healthcare systems once we ultimately all, as many as possible, get vaccinated and we find our way through this pandemic and back to some degree of normalcy in our communities, but some degree of normalcy in our healthcare system as well. And we're going to have some work to do there, and some of the very busy times lie ahead for those in our healthcare system. And if that isn't cause, in addition to keeping yourself and your family members safe, for you to consider going out and getting vaccinated, that would be disappointing.
Do you have a follow-up, Josh?
Yeah, my second question would go directly to Premier Moe. You mentioned a return to somewhat normalcy, and one of the questions and concerns I guess we've gotten from plenty of readers and listeners is that they feel they don't know when or where and how we would get to fully normal, I guess, in pre-pandemic life. Do you have a specific? Would you be able to put a specific number or goal on exactly what it would take to get to that level of normalcy, whether it's 95% vaccination or some other number? Is there a set number that you could put on a set return to normalcy, or is that too far down the road?
No, 70% of adults 18 and over will move us into phase 3. The only conversation that we'll have between now and that point in time is how large of crowd size we'd be able to gather, and our masking mandate, our indoor masking mandate, where we would, at what point in time would we remove that. We're expecting, as we say, we're at 51% today, climbing roughly many days, 1%, 0.75% a day. So we're looking, not too many days away, likely sometime we would hope in mid-July, to be able to move forward with that phase 3. Ultimately, we'll have many people that will be received or have received their second shot. Most people likely will have been eligible for their second shot by that point in time. And so that's precisely the rough dates that we're looking at, but we're looking more at the vaccination rates, which are driving our roadmap to reopening, which is the 3 phases. But phase 3 is 70%. 3 weeks after we hit 70% of everyone 18 and over, roughly mid-July, save for the gathering size and the indoor masking mandate, which we will come to some decision on prior to that point.
Could you have contemplated stage 5 of the initial reopening plan? Because I think that was a question. Basically, an end to social distancing.
Yeah, it was. I think you'll see a degree of physical distancing likely carry on for some period. Maybe even forever in some people's mind. But with respect to the only public health measures that could potentially be in place past 3 weeks after that stage 3 reopening would be the indoor masking mandate, of which we'll come to a decision by that point in time, as well as the how large of crowd will we be ready to move forward with in the days after that. So those are the only 2 variables that are left. And we're going to endeavor to come to some degree of clarity before we actually move forward with the stage 3,
so no
phase 3.
On stage 5 yet of the first plan. That's what.
There's 3 phases in the plan.
No, I'm talking about the first plan was stage 5 because that talked about the social distancing, that talked about the large crowds and everything else. And I think the question was, can you clarify when we're going to reach stage 5 of the old plan, which I assume is still in effect?
No. Dr. Shahab, you might have a comment on physical distancing. You may see physical distancing not by public health measure, but by people's action be part of everyday life as we move forward. As far as the official public health measures go, we're in a 3-phase plan now. The 2 public health recommendations that will be in place, could potentially be in place 3 weeks past the phase 3 benchmark of this plan. Would be the indoor masking mandate and the population size. How big of a gathering are we going to actually gather? Dr. Shahab, do you have anything to add on physical distancing as we move forward with respect to an official public health order versus what people may just do after being used to it for 14 months, 15 months?
Yeah, thank you. So, I would like to say that we need to be humble and cautious that, we need to have a high vaccination rate, have low numbers heading into July that enables us to do more and more, but constantly monitoring, keeping our testing rates up, having the ability to do contact tracing. And we have to realize that last time I checked, Saskatchewan was not an island, and we are integrated deeply into not just Western Canada, but nationally and as part of North America. And of course, many Canadians travel for essential reasons or for pleasure. So as we look at the midterm and long-term future, we know that COVID will be an issue globally. There'll be new variants of interest. Some of them will become variants of concern. So we need to just keep an eye on those things as well. So as we, reopen, there's more and more we can do as families who are fully vaccinated. There's more we can look forward to, a more normal school year. Some of the interactions at workplaces. But we need to be aware of what's happening in other parts of the country or the world when we have to travel, the essential reasons or other reasons. And I think that is something that we'll have to carry with us for the medium to long term, till such time that COVID is no longer a global issue or is at a level that it's like any other, illness that may have a seasonality to it. But I think we need to be cautious and humble. And I like to just say two things to the earlier question as well, that, obviously the Premier said that, we have learned many things or rediscovered the importance of family, community, social connectedness. When you can't connect in person, you realize what you miss, and we have reached out to our friends and family wherever they are in the world through other means. And as we move forward and rediscover meeting in person in a safe manner, we also need to move forward, in that careful, cautious way. So we should be hopeful and optimistic, but also humble and cautious because, if something else comes up in terms of a new variant, we should be able to deal with that, the same way as we have been dealing with issues as we've moved along. Thank you.
And those are things we're watching very closely with respect to, new variants, things of that nature. But, we've talked in here many times, and our entire reopen plan is based on vaccination rates, the floor, and we're seeing vaccination rates already go higher than where our first phase floor was. We're at 72% of those over 40 today. So it continues to climb, and that's a positive metric. We do want the high vaccination rates for a number of reasons. One, yes, so we can go back to some degree of normal. And we are going to go back to a normal society here. That is why we are asking, encouraging, making it as accessible and as convenient as possible for everyone to get vaccinated. Ultimately, there is going to be a small percentage, and people are, but there is going to be a small percentage of people that choose not to get vaccinated. And they should understand that we will be going back to normal. The vast majority of people will be protected through vaccination, and you may not. And with that comes a certain degree of risk. We are seeing, with variants of concern, younger people that are getting sick from COVID-19, younger people ultimately that are ending up in our hospitals. And if you choose not to be vaccinated, when we have provided access and the opportunity to be vaccinated from corner to corner in this province, there is a certain degree of risk that you are choosing to live with, and we will not keep society in Saskatchewan locked down when you have made a conscious choice to not take a vaccine that has been offered to you. So we will be going back to normal. We have put out the three phases that are there. We expect to achieve those phases in the weeks ahead and over the course of the next month or two. And we look very much forward to not a one-dose summer, not a Trudeau summer. We look forward to what we are having right now, which is a one-dose spring, ultimately a two-dose summer, and filling our Mosaic Stadium with a number of people sometime late summer and going into this fall.
That concludes today's availability. Thank you for joining us.